come, stay with me. So I think it would have been nice if we could have started our lecture just answering all those interesting questions. They came up here, but what actually is going to happen is we're going to ask a lot more questions. Not all of them are going to be answered because this issue is really a bit vague, not only for us. But Keren and I, through the years, worked together and wrote some things together, and we were teaching together, and I think we, just as all of you, are being challenged in our clinic, trying to use our ancient toolbox of Chinese medicine and apply it into modern diseases or pathologies, especially if you talk about fertility and the use of ART drugs. And it will be my job to lead you to the practical part and the clinical part that Keren would talk about. My part is mostly show you how we were thinking and how did we use the root of Chinese medicine in order to get where we get and suggest an idea. It's not a solution, and it's not that we think we are right. We're trying to offer something that is rising out of the ancient Chinese medicine that we all know.
Just before Anat starts, I'd just like to add that maybe many of you don't know, but in Israel, the state funds IVF treatments or ART treatments for women up to the third child, including the third child, up to the age of 45. Therefore, Israel has, I think, notoriously been known as an infertility or fertility empire, for good and for bad. As Chinese practitioners, we see a lot of patients, especially those undergoing fertility treatments. And this lecture stems from that, from our clinical experience with hundreds of women during treatments.
Okay. Do we need to say?
Ja, okay. Also nur mal vorab, ich habe die Lecture von den Leuten heute auch erst heute Morgen bekommen, weil ich Ersatz bin für jemand anderen. Das heißt, ihr müsst mir einfach vergeben für ein paar Dinge. Ich mache das ja auch on the go. Okay, also die Anat wird als erstes anfangen und wird über den theoretischen Aspekt reden, wie sie überhaupt denken in ihrer Behandlung in Israel, wie die Denke ist, ja? Wie der theoretische Hintergrund ist. Und die Keren wird dann später über den klinischen Teil ihrer Behandlung sprechen. Sie kommen aus Israel, und Israel ist berühmt sozusagen als das Königreich für Infertilitätsbehandlungen, weil dort die Regierung ART und IVF-Behandlungen unterstützt. Finanziert, ja, also oder teilfinanziert, ja. Oder, bitte?
Vollfinanziert bis zur Geburt eines zweiten Kindes.
Okay, vollfinanziert bis zur Geburt. Oh, okay. Okay.
Okay. So last year we presented here in Wörterbuch a poster regarding what we call pharmacoenergetics, trying to explain the energetic of ART drugs, especially clomide, in the eyes of Chinese medicine, if you remember that. And this year our goal will be to prognose and plan our treatment, okay, for women going under fertility treatment, whether they're being assisted with ART drugs or not, using the concept of the 5 elements. Okay? It's not using 5 elements for the choice of points. It's just thinking 5 elements in order to create some kind of structural model that we can lean on our decision making.
Okay, also letztes Jahr hatten Sie einen anderen Teil hier präsentiert bei der im Rotenburg-Seminar, falls einige von Ihnen da waren. Da ging es eher um den pharmazeutischen, wie sagt man das auf Deutsch, Pharmakogenetics? Also den pharmazeutischen Aspekt für eine medikamentösen Behandlung. Und dieses Jahr wollen Sie sich vor allem auf den 5-Elemente-Aspekt, also das 5-Elemente-Modell in der TCM und in der Behandlung von Infertilität befassen.
Okay, so in order to get to the practical part, we have to go through the process of going back to the roots, as I said, and I want to talk if we start at the very beginning about the Tao, and actually I wanted to talk about it from a different angle, a little bit from a more universal aspect, from the place where we are all dealing with the same thing, and I want us to look for a second at the symbol of the Tao, okay?
Okay, bevor wir also mit dem klinischen Teil anfangen, müssen wir ein bisschen ausholen und wir holen so weit aus, dass wir zurück zum Tao gehen, ja? Und sie möchte jetzt was zeigen über das Tao.
So if we're looking at stress as something that relates to conflicts, okay?
That we like to?
Conflicts.
Oh, okay.
Okay?
Related to conflicts, okay.
Yeah, related to conflicts. If we look at the symbol of Tao, the round one,
Also wenn wir uns das Tao-Symbol angucken in Bezug auf Konflikte und Probleme,
actually it is a shape with no conflicts.
gibt es
It's a
keine.
non-conflict shape.
Ja, es ist kein Konflikt darin, alles ist rund.
Different culture, different time. Arabs, way back in Babylon, invented algebra, okay? And the numbers, did you ever thought about it? But look at the angles that are representing conflicts, okay?
Okay,
Think about it for a second in that.
jetzt schauen wir in eine andere Kultur, eine andere antike Kultur, die Araber. Sie haben die Nummern erfunden im antiken Babylon. Und schaut euch die Konflikte an, sozusagen in den scharfen Linien.
Just for a second. It's okay, one had one conflict, two.
Eins hat einen
two
Konflikt.
conflicts. And so as we go on, 9 has 9 conflicts. And then after 9 comes the whole again, or 10, which is one conflict and the Tao. So it's not something only Chinese medicine we're looking at. All cultures, all people, all around the world are looking or trying to solve this issue of conflict opposed to non-conflict. How does it affect our lives? How does it explain the phenomena of life or other phenomena at all?
Okay, also nicht nur die Chinesen haben geschaut, wie Konflikte bestimmte Phänomene im Leben darstellen, sondern auch die Araber, und die Winkel in den Zahlen, in den arabischen Zahlen sind repräsentant für Konflikte sozusagen. Also 1 hat einen Konflikt, hat einen Winkel, 2 und so weiter bis zur 9 und dann die 10 ist wieder rund. Also das ist die Befassung mit Konflikten. Ja?
Also das sieht jetzt aus wie eine 7-Segment-Anzeige am Radiowecker. Also ich schreibe eine 8 nicht so. Also das scheint mir willkürlich zu sein, das so darzustellen.
Am I being challenged?
Yeah. He's saying your 8 is rather awkward because, you know, the ancient 8 has no conflicts, but yours is like a digital 8.
Actually, I took it from an algebra kind of book or idea.
Ja, sie hat das einfach nur 1:1 kopiert vom
true.
Algebra-Buch.
You know,
Aber
but
du
the
hast
idea
recht,
is just
ja.
to show us
Es gibt nur eine Idee.
what I'm
hier.
going to say now, to bring us to the next point.